Hello, dear colleagues. I'm going to present you the results of our research, impact of Russian war on COVID-19 dynamics in Germany, the simulation study by statistical machine learning. Coronavirus infection is an infectious disease caused by SARS-CoV-2 virus. The outbreak was first reported in Wuhan, China in December 2019. And on 30th of January 2020, the World Health Organization declared the outbreak as a public health emergency of international concern. Moreover, on 11th of March 2020, a global pandemic was declared. At the end of September 2022, almost 620 million cases were registered worldwide, and 6.5 million of which ended in death. The COVID-19 pandemic in Germany has been observed since the end of January 2020. As of autumn 2022, 4 waves of infection were observed, and the 5th one is still ongoing. High mortality was observed during the first waves, as older age groups were affected. During the 3rd and 4th waves of morbidity, the healthcare system responded effectively by increasing the number of beds and intensive care units. In November 2020, Germany's national vaccination strategy was adopted and started on the 26th of December 2020. And at the end of September 2022, 33 million cases of COVID-19 were registered in Germany, of which almost 1,500,000 were fatal. Almost 65 million people were vaccinated, and it's more than 76% of population. The escalation of the Russian war in Ukraine launched on February 24th, 2022, caused destruction, human casualties, and humanitarian crisis. The military invasion also affected the healthcare system in Ukraine, and factors stimulating the spread of infectious diseases have also increased. The temporary occupation of the territories of Ukraine by Russia and active hostility stimulated migration flows both within the country and to neighboring countries. As of September 2022, 7.4 million refugees from Ukraine were registered in Europe, and 4.13 million citizens of Ukraine received the status of temporary protection in the countries of the European Union. More than 1 million refugees from Ukraine are registered in Germany, and more than 700,000 have received temporary protection status. The migration of the population, as well as the conditions for the evacuation of refugees in Ukraine, is an essential factor that affect infectious disease dynamics. So this study aims to test the hypothesis of the influence of migration flows caused by the escalation of Russian war in Ukraine on the dynamics of the COVID-19 epidemic process in Germany. For this purpose, a model of the COVID-19 epidemic process based on the polynomial regression method was developed and analyzed. To test the hypothesis of the impact of migration flows from Ukraine caused by the Russian military invasion on the dynamics of the COVID-19 epidemic process in Germany, the following methodology is proposed. The first step will build a simulation model of the COVID-19 epidemic process based on the simplest machine learning method. That will check the adequacy of the developed model by constructing the predictive dynamics of the COVID-19 epidemic process in Germany for 30 days before the start of the escalation of Russian war in Ukraine. After that, to build a forecast of the dynamics of COVID-19 epidemic process in Germany for 30 days after the start of the escalation of the Russian war in Ukraine, we built forecast for that period. And as a final stage, we'll estimate the deviations of the forecast compared to actual data to compare forecasting errors before and after the start of the escalation of Russian war in Ukraine for different periods of forecasting. Since the purpose of the study is only a preliminary test of the hypothesis about the impact of migration and dynamics of COVID-19, one of the simplest statistical machine learning methods, polynomial regression, was chosen as a simulation model. Polynomial regression can be used in mathematical statistics. When modeling the trend components of time series. The purpose of building a polynomial regression model in the field of time series is forecasting. Polynomial regression models only the trend component of the time series. The parameters of the regression model polynomial are found by the least squares method. With polynomial regression, we can model nonlinear relationships between variables and predict nonlinear functions. And various functions can be used to find the polynomial and tune the model. However, polynomial regression is not a universal tool because outliers in the data can significantly affect the simulation result. Also, polynomial regression models are subject to overfitting. So their generalization is difficult outside the data used. Nevertheless, the polynomial regression model is an effective tool for preliminary research and identifying trends and forecasting. So for the experimental study, a model of COVID-19 epidemic process was built based on polynomial regression methods. And to train the model, we used data on cumulative morbidity and mortality from COVID-19 in Germany, which we collected from the World Health Organization coronavirus dashboard. To test the adequacy of the model forecast of cumulative new and death cases of COVID-19 were built for 30 days before the start of the escalation of the Russian war in Ukraine. So you can see that forecast in the slide. The left one is the cumulative new cases, and the right one is cumulative fatal cases. And the period of forecasting is from 25th of January 2022 till 23rd of February 2022. The next step was the assessment of the impact of migration flows on the dynamics of the epidemic process in Germany. And for that, we forecast the cumulative new and fatal cases for 30 days after the start of the escalation of Russian war in Ukraine. So you can see on the slide, the left plot is forecasting of new cases, and the right is fatal cases. The period of forecasting is from 24th of February till 25th of March 2022. So on the next slide, you can see the model's accuracy for both periods. So the left table is for periods from 25th of January till 23rd of February. And the right one is from 24th of February till 23rd of March. An assessment of the accuracy of the predictive dynamics of COVID-19 in Germany showed high adequacy of the model. And at the same time, similar model accuracy is observed when predicting cumulative fatal cases 30 days before the start of the Russian war in Ukraine escalation and 30 days after the start of the escalation of the war. The accuracy of the predictive cumulative new cases of COVID-19 in Germany is lower after the start of the escalation of the Russian war in Ukraine. At the same time, the forecast of new cases after the start of the escalation after the start of the evacuation of Ukrainian residents to Germany still shows high accuracy, from 95.7% for a 30-day forecast to 97.3% for 7 days forecast. This suggests that the constructed model can be used in public health practice. However, the accuracy of the forecast after the escalation of the Russian war in Ukraine is lower than before the escalation of the war, which suggests that the migration flow of refugees from Ukraine is one of the factors that influence the dynamics of the COVID-19 epidemic process in Germany. However, the lack of changes in the accuracy of death suggests that the migration of refugees from Ukraine to Germany in general didn't affect the epidemic situation regarding the incidence of COVID-19 in Germany. So the escalation of the Russian war in Ukraine stimulated the spread of infectious diseases And among the factors that contribute to the worsening of the epidemic situation are the difficulty in obtaining medical care in areas with active hostilities, the redistribution of healthcare system resources for the need of the army and to help the affected civilian population, the high population density while in bomb shelters, the mental replacement of the COVID-19 problem with survival during the war, and so on. An important factor influencing the dynamics of infectious diseases is population migration. At the same time, this process is essential in war conditions. People were evacuated from the temporary occupied territories and territories with active hostilities in overcrowded trains without observing anti-epidemic rules. When crossing the border with the countries of the European Union, there was a considerable population crowding, and medical records and vaccination information were not checked. Also at the beginning of the escalation of the war in Ukraine, there was an increase in the incidence of COVID-19 caused by the Omicron strain. The COVID-19 vaccine campaign in Ukraine began exactly 1 year before Russia's full-scale invasion. And as of February 2022, the number of those vaccinated in Ukraine was 38.24%. To test our hypothesis about the impact of migration flows, we have built two kind of forecasts for 30 days before the escalation of Russian war and 30 days after the start of the escalation. Although the model showed high forecasting accuracy for both forecast periods, the accuracy of predicting cumulative new cases of COVID-19 in Germany after the start of the escalation of the Russian war in Ukraine became lower than before the escalation of the war. This suggests that the migration of the population from Ukraine to Germany influenced the dynamic of the COVID-19 epidemic process, although it didn't become a decisive factor. However, the lack of deterioration in model accuracy for cumulative deaths from COVID-19 in Germany after the Russian military invasion of Ukraine suggests that in general migration flows have not changed the epidemic situation regarding COVID-19 in Germany. This research is part of our big information system for decision making according epidemiological diagnostics, so you can find more models and methods by that QR code. And thank you for your attention.